Hello, this is Karen Kowal. My name is Karen Kowal, and I'm a registered nurse and a licensed massage therapist from Arnold, Missouri. That is the home of Mother Earth Pillows. We manufacture all of our products there, and I brought some pillows today, and I'm going to demonstrate the shoulder girdle treatment, and it's a very brief treatment, but very, very effective. The pillow that I'm going to be using is the body wrap. It's the longest pillow that we make, and it's just perfect for what the technique that we're going to be using. So we're going to try to demonstrate this to you so that you can see how to do that. And this is Nate, and he's my willing suspect here. We're going to demonstrate this, that this is pretending like a sheet, so I can demonstrate how to work over a sheet. You just use the pillow right over the sheet. Or we also have the easy off covers, and I'll demonstrate how to put that on the pillow in just a few minutes. The first thing we do is create a little bit of a space here, the pillow, drape it over the arm so it doesn't pinch the pillow. Very loosely and lightly hold the wrist or the heel of the hand, because you want to be able to rotate this to access different attachments. What we really do in thermal connective tissue release or Pillossage is we work on the attachments of the muscles, the tendons, the ligaments, actually the origins, so that we're working all the way down to the periosteum without creating pain. This is a way, the reason that that happens is because when you're working with heat, it melts down and decreases the guarding that goes on, so that we're going to use heated pillow to do this technique. So Nate's arm is very relaxed, and I'm applying forward or headward pressure to the top of the pillow and holding it. I'm actually feeling the humerus rotate under my hand. And you repeat this. Adjust your stance so that there's plenty of freedom to move the arm towards the floor, never going past resistance. So I call that just going to the wall and holding and sustaining. This is actually changing the ground system, the ground substance of the connective tissue from gel to sol. The heat is. So I start working up the arm, accessing more and more attachments. So as I'm moving up towards the shoulder, pretty soon I'm feeling through the pillow the anterior deltoid. And I'm feeling it kind of meet my palm of my hand, because underneath that, the attachments of the lats and also the teres. I'm going to slide my hand under the arm without grabbing the client. One of the things that I avoid with all the techniques that I teach is never grabbing the client, so I don't have to worry about a grasp. This is, if you think of the hands of a clock, this is kind of facing the 5, and I'm facing the 10 up here. So I'm compressing towards the 5 and letting the arm drop down as I'm pinning the wall of the pec. I don't want to get right into the axillary area, because that can be very, very tender. So I want to actually increase stretching the pec, major and minor. At this point, I'm going to raise the client's arm while pressing down and actually hooking in, bending my wrist and hooking in towards the table and locking down on the teres and the subscap. Ask the client to take his right hand and hold on to his elbow, and I bring his elbow out just a little bit, and I say, this is neutral. So I want to ask you to take a nice deep breath. And as you exhale, I'm going to increase my compression as he draws his arm across his chest, just to his comfort level. Return to neutral. Again, nice deep breath. And do it again. You may need to repeat this several times, especially if there's congestion there, if there is or old adhesions. Now this time I'm going to ask you, as you move it from neutral, to bring it in an arch as you exhale over your nose and give me your arm. Okay, nice deep breath. And again, I compress. The flexes actually meet is actually moving into the deep area of the, and accessing that little wedge between the ribs and the teres. So we're really accessing a lot of tissue there that normally pokey fingers do not feel good. So now we are going to compress towards the waist, and I'm just rotating his arm in just very gently with a flat hand. I'm not grabbing him, but I'm with a flat hand. I'm rotating his humerus as I'm stretching. So it's a pin and stretch, or stretch, compress, stretch, and release. Compress, stretch, and release. And as I compress, I'm letting that heat sink and take that tissue as far as it will. So this is a myofascial release, treating the entire quadrant. Whenever you have a shoulder girdle injury, the best option is to treat the entire quadrant that's involved, of the shoulder that's involved. Then I bring his arm down to rest on the table because it's totally relaxed now. One of the other techniques that you use, these are the new products. These are called paw pads, becoming very popular. These are little pads that you can slip on your hand. This is the hot flax. So this can go into the ASIS. So you can get in there without any pokey fingers, and the client will not feel ticklish, and they will not feel pain. They won't feel your pokey fingers. And you can do stretches there. You can also get into that subscap region. Let me pull this down so the camera can see. And you can actually hold that tissue down as you take the arm into a stretch, cross-body stretch. So these little paw pads have become very, very popular. They're sold in pairs. Okay. So while Nate is still here, he's just going to rest from that for a moment. I'm going to show you quickly how to dress this pillow. This is one of the easy off covers. Just put your hand through, pull the pillow up as far as it'll go, shift it around, and finish dressing your pillow. You have now dressed your pillow. This is the easy off cover. We sell them in sets of 4 so that you have something that you can cover and use as a barrier between you and the client's skin, or you can cover the client's skin with a pillowcase as you see, or a sheet as you see. And that's the shoulder treatment that is using the body wrap. MotherEarthPillows.com is our website. You can go and see more information about the classes that I hold on Pillosage.com, and that's Pillossage. And I'd love to have you visit. Thank you very much.